Welcome to today's virtual town hall entitled Transitioning to the Humana Group Medicare Advantage PPO Plan. My name is Carrie Mitchell, and I'm one of a discipleship dozen of church consultants here at the Board of Pensions. I'm joined today by my colleagues, the Reverend Dr. Frank Spencer, President of the Board of Pensions, Pat Haynes, Executive Vice President and Chief Benefits Officer, Kelly Riley, Executive Vice President, Plan Operations, and Sharon Castillo, Director, Plan Administration. Today's conversation shares the reasons for the change to the new Group Medicare Advantage PPO plan and reiterates our commitment to serving retired members. In just a moment, I'll share some housekeeping to help us all participate well in our time together. But first, before we jump in, will you join me in prayer? Gracious and loving God, we give you thanks today that you have called us to serve you and the body of Christ. We are particularly grateful for the countless creative ways your retired servant leaders have helped our world know you and love you. Though separated by distance, we have confidence you are amongst us, drawing our hearts and minds together. We acknowledge both the joys and challenges of being in community. Every time we turn to your word, we are reminded that our church's story is filled with in-between spaces and places. At the same time, we are reminded of your abiding presence with us, that you are always there, leading us into good futures. We acknowledge the many emotions we each carry with us into this conversation: anxiety of the unknown, grief that comes with change, hope for new futures, and so many other emotions in between. We are thankful for the creativity, honesty, grace, and resilience within each of us that collectively will contribute to this future unfolding before us. In Christ's name we pray. Amen. And now, it's my privilege to turn you over to our president, the Reverend Dr. Frank Clark Spencer. Welcome, Frank.
Thank you, Carrie. It is a pleasure to be here with 1,000 of you who have answered God's call to serve in ministry. We are grateful to God for your work among us, and we are grateful that you've joined us today. You're going to be hearing a lot about our transition for our Medicare Advantage program. You'll hear from our experts in just a few minutes. But let me give you just a word of introduction. We are making this change because over the past few years, the way that Medicare costs are paid in this country has dramatically shifted. And it's our responsibility to get you the best benefits possible for the best economic price possible. You're going to learn why our proposal fits that criteria. It's not because the board needs money. It's not because we make any profit out of this. Neither of those things factor into our work. It is because we want each of you to have the best program available. Now, it will continue to be a group program of the board, and as Carrie suggested, you are always free to call us with concerns or questions, or to call directly to Humana if you can't find the right answers. We are here to help you. We are here to be your advocates. We also know that the economic benefit is real. All of you, or most of you, are current pensioners, and your Medicare supplement comes out of your pension check. What you're going to learn today is that you will receive a significant increase in the amount of your pension come January 1st of this coming year. We're excited about that. We know that it will make a difference in each of your lives. And so, without further ado, I want to pass this on to our expert team and invite them to welcome you in to the detailed conversation that will get your questions answered. Thanks for being with us.
Thank you so much, Frank. I'm Pat Haynes, as Carrie suggested, the Executive Vice President for Benefits. Let me start with my own personal welcome to all of you. We are incredibly grateful for your lifetime commitment to the church, and especially for your presence with us today. If I could, I'd like to start with the why. Why the change to a group Medicare Advantage plan, and why Humana? A few facts about our Medicare supplement plan will hopefully provide some useful context. It is, as you know, a plan that complements traditional or original Medicare, both Parts A and B, by covering all the relevant deductibles and coinsurance, filling in the gaps, if you will. And it includes a qualified Part D prescription drug plan. It has served many retirees well for many years. It is a self-funded plan administered by Highmark Blue Cross Blue Shield. Claims and expenses are supported entirely by the rates paid by you, our retirees. Outside of some very modest federal government subsidy support received for the prescription drug plan, there is no other source of revenue for this plan, and it's operating at a loss. The revenue we are collecting is simply not adequate. That is why we had to increase our rates by 24% this past January. And our actuaries have projected that next year's increase would even be steeper, taking the cost to over $400 per individual per month. Since we're already serving fewer than a third of our retirees, likely because of these costs, which are increasingly unaffordable, we felt we owed it to all of you to explore other options. Our commitment to all aspects of your health and well-being, economic as well as physical and emotional, simply demanded that we do better. With support from highly specialized consultants, we sent bids to 4 of the leading Medicare Advantage carriers, and we received formal proposals from 3. Let me review with you some of our core requirements. No one could bid unless they met these requirements. First, the coverage had to be equal to or better than the coverage provided under our Medicare supplement plan. Second, the design had to be a passive PPO so that our retirees had the greatest provider access possible. And I'm going to talk more about this network design in just a minute. Using our actual claim history, the carrier had to demonstrate that at least 85% of the providers used by our retirees were either in the network or had a history of billing the carrier directly. The carrier had to provide dedicated and skilled customer support, both to our retirees and to the folks on the board's member service team who are accustomed to helping you navigate complex issues. Humana, an organization that has been in this business, the Medicare Advantage business, for nearly 4 decades, met or exceeded every single core requirement. And they came to us with a history of serving retirees from the ELCA, the Evangelical Lutheran Church of America, the United Methodist Church, and the United Church of Christ, all sister denominations who have been on similar cost journeys. The coverage that they will provide is absolutely better than that of the Medicare supplement plan, and better than any individual Medicare Advantage plan available to you in your local markets. And that's because the board negotiated the contract, as Frank suggested, on a group basis. The carrier had to provide dedicated and skilled customer support, both to our retirees and to the folks on the member service team here at the board, who are accustomed to helping you navigate complex issues. They had to demonstrate unique cultural sensitivity to our population, a faith-based population. Humana has been in this business for nearly 4 decades, and they met or exceeded every single core requirement. And they came to us with a history of serving retirees from the Evangelical Lutheran Church of America, the United Methodist Church, and the United Church of Christ, all sister denominations who have been on similar journeys. The coverage that they will provide is absolutely better than that of the Medicare supplement plan, and better than any individual Medicare Advantage plan available to you in your local market. And that's because the board negotiated this on a group basis. With an annual maximum out-of-pocket cost of $2,590, there are no deductibles. All primary care and preventive services, including office and lab, are covered at 100%. Those services that are subject to cost sharing, like specialists and imaging, are covered at 96%. That means a very modest out-of-pocket cost to you. Give you an example. On a charge of $200, your 4% cost share would be $8. The drug coverage, while supported by a unique formulary, similarly constructed to ESI's formulary, is an exact benefit match to our current plan. As required by Medicare, your cost for insulin is capped at $35, and there is an out-of-pocket cap on your cost of $2,000. So the drug coverage, it is supported by a unique formulary, and that's very similar to what ESI does. Again, your insulin cost will be capped at $35, and your out-of-pocket maximum for the year will be $2,000. And this plan will provide benefits that aren't currently part of our Medicare supplement program today, including vision, dental, hearing aids, and silver sneakers, all things that over the years you and other retirees have asked us for. There is, as you will see in your experience with Humana, great value that they place on health and well-being, very aligned with our culture. And the Humana plan design, and I'm coming back to this from an earlier comment, is a passive PPO, which means that you absolutely can go to a non-network provider if that provider accepts Medicare and is willing to bill Humana, because Humana will reimburse that provider at 100% of the Medicare allowed amount. Really important distinction between many individual Medicare Advantage plan and our group Medicare Advantage plan is this notion of a passive PPO. In an evaluation of our historical claims, Humana was able to demonstrate a network match of better than 90%. That means that more than 90% of the providers you have used are either in the Humana network or have a history of billing Humana and accepting the Medicare allowed amount. Through our implementation work, we have met the leaders of the customer support team who will be directly servicing our members and know that they will provide a level of service that meets our standards. They have already fielded many questions from our retirees about benefits and providers. And as Kelly Riley will describe in a few minutes, the board has a dedicated resource at Humana to whom we can turn for resolution of complex issues as the needs of our retirees warrant. And finally, and not insignificantly, Humana has committed to a 4-year price of $0 per individual per month. $0. $360 today, $0 as of January 1st. For many of our retirees with a covered spouse, this means an additional pension income, as Frank suggested, but let me put dollars to that, of $680 per month, over $8,000 per year. While we are confident that this move honors our commitment to the compassionate care of the retiree community we support, and that we have found the right partner in Humana, we also understand some of the worry and concern that many of you feel about this change. Before addressing some of what we heard, let me emphasize again that a group Medicare Advantage plan is very different from an individual one. And the passive PPO design we've secured means that our retirees are not constricted by a narrow provider network. Humana clearly has one of the largest PPO networks, but the ability for a non-network provider to bill Humana and be paid the full amount of the Medicare allowance makes provider access even that much greater. Referrals are not required. But even with all of that said, we know that some of you do not share our confidence. In my conversations with you, I've heard that you worry about having services or treatment denied, a reputation purportedly earned by at least some Medicare Advantage plans. While every situation is unique, I can tell you that Humana must follow the same medical necessity guidelines as Original Medicare. Sometimes services are denied purely because the carrier does not have enough clinical information. So I'm going to urge you to encourage your providers to engage with Humana. They're the best source of advocacy for your care. Unlike Original Medicare, Medicare Advantage plans do require that some services be authorized in advance. There's a published list of these services, and network providers are generally equipped to manage this requirement as part of doing business. But it simply may feel more restrictive. What I could say about this is that Original Medicare may make determination at some point after the fact that a service or procedure failed to meet those same medical necessity guidelines. The consequence of that might be an after-the-fact denial, which could have significant and surprising economic impact. If services are denied by Humana, it's important that you know about the 2 levels of appeals available to you. The second level, should you need to exercise it, is performed not by Humana, but by an independent third party. In fact, when we asked, and we did, about the frequency of appeals and their disposition, Humana advised us that a large majority of appeals result in a favorable result for patients. Finally, some of you have expressed what I'll call a healthy skepticism about the ability of Humana to provide this level of coverage at a cost to you of 0. Honestly, that's an entirely legitimate question and skepticism. It is not, after all, customary to get something for nothing. CMS, or the Centers for Medicare and Medicaid, have developed a rather unique reimbursement model that favors Medicare Advantage plans. And Frank referenced that in the beginning. They make payments to Humana and others based on a lot of factors, but the 2 that I will call out for you are performance and risk. Because Humana is consistently rated a 5-star performer, and that's measured largely in terms of clinical outcomes and patient satisfaction, the Medicare reimbursement is, on a relative scale, higher. And because of the average age of our population, which is just around 80, the risk factor adjustment also results in a higher payment. So in extending this $0 premium high-value plan to us, Humana is signaling that the reimbursement rate is more than sufficient, the one they receive from the Centers for Medicare and Medicaid, to cover the anticipated claim and expense cost. In this regard, Medicare Advantage plans have an absolute advantage over Original Medicare. We know that this isn't a perfect solution for each and every one of you, but on balance, we fundamentally believe that it is a better solution for most of you. In a few minutes, after Kelly Riley shares some comments about our continued member service support, Sharon will talk about some of the resources you might use in the individual exploration of some alternatives in your local market. More than anything, it is important that we hear from you with any concerns that I haven't addressed or that we won't address before we leave you today. And remember that in October, we will be hosting webinars with Humana representatives who will share more specific plan and formulary information. But now, let me introduce my friend and colleague, Kelly, our Executive Vice President responsible for our member care team. Kelly, thanks.
Thank you, Pat. Good afternoon, everyone, and welcome again. My name is Kelly Riley, and I am the Executive Vice President of Plant Operations here at the board. In my role, I am responsible for ensuring service to you that we can all be proud of. Service is the hallmark of what we do each day here at the Board of Pensions. We are committed to providing dedicated service, professional expertise, care, and compassion to help our retirees through the transition to Humana. Our service delivery model consists of a dedicated team of service specialists that are skilled and trained to walk with you through the transition to Humana. When you call our Philadelphia-based service team at 800 Press Plan, our retirees will be directed to this dedicated team of individuals that begin every conversation with, "How may I serve you?" Our service specialists are trained to maintain an excellent understanding of the benefits plan and have recently received comprehensive training to support our retired members through the transition to the Humana Group Medicare Advantage PPO plan to answer your questions and provide consultative service, which is foundational to our work and plan operations. Our longstanding tradition of service excellence is a defining characteristic of how we will support our retirees. Each and every time you call the board, you provide us with an opportunity to thoughtfully assist you with questions and concerns. The very good news is that you can expect the same level of quality service from Humana. They have a dedicated customer care service team, and the board has been assigned a designated contacts for any issues that need to be escalated. As I shared with you, your dedicated team of specialists here at the Board of Pensions have been trained and skilled to answer your questions. However, you should know that there are certain questions that need to be directed to Humana about your healthcare benefits. For example, is my drug covered? What tier is my drug? And how much would it cost me? Another question could be, how will my regular visit to my podiatrist be covered? Humana would be able to tell you if your podiatrist is in the network, what kind of podiatry services are covered, and whether coinsurance would apply. Although these questions may not be answered for you here at the Board of Pensions, we can certainly warm transfer you to Humana and stay on the line with you if you wish until your questions are answered to your satisfaction. This type of service is part of our commitment to walk with our retirees through the transition to Humana. Once enrolled in the new plan, Humana will be your primary source of information about healthcare benefits. Resources available to you will include a dedicated customer care team at Humana. Their phone number is 855-273-0021. They are available to you Monday through Friday from 8 a.m. to 9 p.m. We have the dedicated service team at the Board of Pensions here for you at 800 Press Plan. That phone number is 800-773-7752. We are here to serve you from 8:30 a.m. to 6 o'clock p.m. You can also visit our website at www.pensions.org/Humana. And the other thing that's on our website available to you is the Humana Summary of Medical Benefits and the Humana Summary of Pharmacy Benefits. Both of these documents are chock full of information that will be helpful to you. Keep in mind, the service team at the Board of Pensions will still be here to serve retirees with a spirit of hospitality. And it is with this spirit that we are here to support you and provide you with consultative service. And remember, for those of you that prefer to reach out to us instead of Humana, you may certainly do so. The Board of Pensions will also continue to be the primary point of contact for questions about pension, disability, and death benefits. I just want to take a minute to thank you so much for your time today. And I want you to please know and please understand that we will be here with you every step of the way. If you need us, we want you to call us and we will be here for you. Now I will turn it over to my colleague, Sharon.
Thanks, Kelly. As you've heard from Pat and Kelly, the change from the board's Medicare supplement plan to Humana's group PPO plan is something we considered very carefully. Part of the earlier discussions with Humana were around the transition of care. We spent a lot of time going over what happens when members move from the MedSup plan to a Med Advantage plan. And quite frankly, Medicare has established guidelines to help with these transitions of care and continuity of care. Transitions can be for a time-limited service designed to ensure healthcare continuity and prevent poor outcomes when members move from one plan to another. One example is that if a member is hospitalized prior to the Medicare Advantage plan being in effect, the responsibility of that claim would be on the insurance carrier that is in effect at the time of the admission. So, for example, if you were hospitalized on December 26th and still in the hospital after January 1st, the current Medicare supplement plan would pay for that hospitalization. If this should happen, we ask that you or your provider be in touch with Humana so then at any care after your hospitalization, they're aware of, they make sure it gets authorized so that you have no issue with the coverage after that. For members with a cancer diagnosis and in the middle of treatment, we also suggest you or your provider be in touch with Humana sometime in December. As long as your provider is in the Humana's network or will bill Humana, there'll be no disruption. Humana also has roadmaps for different types of treatment situations and can work directly with your providers so that there really is a smooth transition. For medications, I suggest everyone make sure they have enough on hand as of January 1st. After January 1st, you can receive one 30-day fill of any medication you're currently on, regardless of whether the medication is on the formulary or needs a prior authorization. By the end of September, you should receive your enrollment kit. If you're currently in the Medicare supplement plan, you'll be automatically enrolled unless you waive coverage. For those of you who retired recently or did not choose the Medicare supplement plan in 2023, your kit has an enrollment form that you will need to complete and send to the Board of Pensions. If you should have any questions, please feel free to reach out to the board, and someone from Kelly's team would be happy to help. Also in the kit, there'll be an invitation to the webinars that Pat mentioned earlier that the board will be hosting with Humana. Humana will get into some of the details of the plan and will be able to answer any questions you may have. Keep in mind, you can reach out to Humana now with any questions. The phone number for Humana is in the chat, and I believe Kelly also highlighted that. You'll also receive an email invitation later this month that will give you a link to this recording and also give you information on how to register for those webinars. In November, you'll be receiving a letter from the board that will notify you that you are automatically disenrolled from the Express Scripts plan as of 12/31. This is a requirement for Centers for Medicare and Medicaid. Please just file this letter. There's nothing you need to do with it. In December, you'll receive a letter from Humana that will indicate if your current medication may not be covered or need a certain authorization. Keep in mind, you still have that 30-day fill that you can fill in 2024 to give you time to discuss other options with your provider or also do an appeal. You will also receive a letter in early December indicating if you have open refills with Express Scripts mail order that will be transferred to Centerwell, which is Humana's pharmacy, along with a confirmation letter in February confirming the specific medications that were transferred. If you're currently taking a controlled substance, this will not transfer and you will need to get a new prescription. In December, be on the lookout for your ID cards. You'll receive just one card, and that will be both for your medical and for your pharmacy coverage. Also in December, you'll receive a welcome call from Humana. I encourage you to answer these calls and ask any of those lingering questions you have about your coverage. And lastly, we know this plan may not work for everyone, as Pat mentioned earlier. If you'd like to explore other options, the state health insurance assistance programs at ship.org or via benefits at my.viabenefits.com will help you explore Medicare plans similar to the Medicare Advantage or Medicare Supplement or other Medicare Advantage plans. So with this, I am going to welcome Carrie back on and my other panelists, and we'd be glad to answer any questions.
Frank, Pat, Kelly, Sharon, thank you. We're now going to open the floor to questions. I want to encourage you to remember to use the Q&A feature of Zoom to enter your content questions. And if you're having technical issues, please use the chat function. Those comments are going to our awesome behind-the-scenes meeting team. I want to highlight a great feature of this platform that will help us answer your most frequently asked questions. If there's a content question in the Q&A box that matches what you want to ask, click the thumbs up on that question and it will upvote it or move it up higher in the queue to be asked more quickly. That helps us see what topics and questions to focus on in this time together. And if we haven't gotten to your excellent question, be not afraid. We will be topically organizing your questions and will place them with our answers into our website's frequently asked questions. Now, as you can see, we've already gotten 99 plus questions and answers and multiple astute questions when you registered. So let's start with one of those while you enter and upvote your questions in the Q&A feature. I'll ask this first one of Kelly. Kelly, when are we supposed to call Humana? And by contrast, when would it be better if we call the board?
Humana should be contacted when there are specific questions about medical services, procedures, and prescription coverage. Humana is also available to confirm how claims will be paid, including whether coinsurance would apply. The Board of Pensions should be contacted to confirm eligibility or to inquire about our enrollment process and practices. We also want you to contact the board if you have any concerns at all about Humana, or if you would like a member of our service team to walk alongside you in a conversation with Humana through a warm transfer. I'd like to just take this opportunity to just reiterate one more time that the Board of Pensions will be with you every step of the way. We are here and happy to serve. Thank you, Carrie.
Kelly, I appreciate your helping us to differentiate between those resources. Pat, this one's for you. What might retirees lose by our switching? Aren't we going to be subject to new actuarial evaluations so that pre-existing conditions that have developed while we've been enrolled on the current Medicare supplement plan are going to drive up our costs with Humana?
That's a great and complicated question. First of all, Humana did evaluate our claims history. We provided them with considerable data in advance of them submitting a proposal to us. Medicare controls all of this. Medicare controls original Medicare, Medicare controls Medicare Advantage plans. There are no and will not be any pre-existing condition limitations. I think an important concept is that which Sharon reviewed around continuity of care. No one wants a patient's care disrupted. Medicare certainly would not support administration of a plan that caused a disruption in care. That is not the objective. Humana was very confident with considerable claim history that we furnished them in assessing our $0 premium charge for a full 4-year period. So no pre-existing condition limitations, no risk adjustments that they haven't already considered in doing their financial evaluation, and no disruption in care. Again, I will say what Sharon said, it's really important to engage your providers so that if you are in the middle of care, and many of you are, then you need to be in conversation with them and let them know that you will be making this change.
Thanks, Pat. That reassurance about pre-existing conditions and the explanation about the Centers for Medicare and Medicaid Services has been very helpful to answer many of these upvoted questions. A follow-on to that is, what can we anticipate the premiums being after 4 years?
That's funny. I'll take that one because I've been asked a couple of times and I wish I could answer it more specifically. What I can tell you is we're not going to go to sleep in this relationship. We have a contract with Humana. Part of that contract is performance management. So they are obligated to provide service at a level that is acceptable to us. We have a special account team that's been assigned to us, a senior executive in whom we have built already considerable trust. So anything that's unfolding will not be a surprise. We will communicate well in advance, and no relationship that we have at the board do we consider is an absolute permanent forever after solution. We routinely put our services out for competitive bids, and we would do that with a Medicare Advantage group contract if it became necessary. So let me just promise that we will keep close watch. It will not come as a surprise from December to January 4 years from now. We'll make sure that all things are communicated and that we are confident that we are giving you the highest value solution that's available in the marketplace at that time.
Pat, that's really reassuring because several of the questions or comments made mention of United Healthcare, and it's good to know that we're going to continue to stay on this relationship. So Sharon, this question's going for you, and there's variations of it in the chat. One of my providers has told me that they're not going to bill Humana. Can you help us?
Yeah, I would suggest that they reach out to Humana because a lot of times the provider isn't aware of this passive PPO because in the individual market, that's not an option. So we suggest going to Humana. Humana has made a lot of calls. I was going to say hundreds. I don't know whether that is true, but a lot of calls to providers to ask them if they will bill Humana. A lot of times they can even, depending on the circumstances, work with one provider for one member and do an agreement. So the best place to start is Humana, because they will be able to explain the plan, explain the coverage, explain how to bill, and how they would get reimbursed.
The only other thing I'd add, Carrie, to that is that, and people have asked, what if my provider won't bill Humana? Could I still see him or her and self-pay and get reimbursed? And the answer to that question is yes, you can self-pay. That's not ideal, but if there's a specific provider that you really want to continue to see, you can self-pay and then submit a claim form. And Humana will reimburse you for that same 100% of Medicare allowable amount.
Yeah, the only caveat to that is they have to be a Medicare provider.
Yeah,
yes.
Thanks.
Ladies, you anticipated the next question, and it's around better understanding this whole passive PPO plan structure and what to do with out-of-network situations. So I'll ask this follow-on question that's a nuance of it. What about my dental and vision providers? How do I find out about them?
Humana has a relationship for dental and vision with providers, and your provider may or may not be in that network. The vision, I will tell you, is very much a duplicate of what our vision plan is. Providers may be different. But just like the medical, you'll have to look at the network and then make sure that your providers will bill Humana for those services. Pat, you want to add anything?
No,
to
I
that?
think this in some ways, because those expenses are generally a little lower for dental and vision, that the idea that you can get reimbursed up to a Medicare allowance if that provider accepts Medicare. Many do, many do. I think, again, the first point of contact is Humana, and the invitation to your provider is to be in conversation with Humana.
Ladies, fantastic. I'm going to switch gears a little bit now and ask a frequently asked question in the question and answer box. What about international travel? Do I still have coverage?
That's one we took very seriously, because we have always prided ourselves in our Medicare supplement program that we have afforded individuals overseas protection. So number one, there is worldwide coverage for emergencies that Humana provides. And it's an important call out and is noted in the summary of benefits. Number two, we are continuing into 2024 our international SOS protection. So for those of you who have traveled internationally and kept that card with you, continue to keep that card with you, because they act in many ways as a concierge as well as a navigator to appropriate care, and also have handled some evacuations back to the States for care. So really important that that we have maintained the relationship with International SOS. You should continue to carry that card. And Humana does have some emergency benefit services as part of their plan of coverage. Anything you'd add to that, Sharon?
No, I think you hit it. But again, the assistance piece of it is really key, even before you travel. They'll be able to tell you what medications you may be able to get while you're traveling and direct you to any appropriate care there.
Thank you, ladies. Pat, you mentioned the SOS card, and this touches upon something that is, again, frequently in the Q&A. Sharon, can you share with us again the mechanics of when we'll get cards and how the transition will happen for those who are currently in our Medicare supplement plan and those who are not?
Okay, so let's start with those who are currently in the Medicare supplement plan. You will be automatically enrolled. We will send a file to Humana at the end of November. They will produce cards and you will receive your ID cards the first or second week in December. You can start using those as of January 1st and you'll be good to go. For those who are not in the plan currently, either retired in 2023 or may have left the Medicare supplement because of the cost rising in 2023, in their enrollment kit, there will be an enrollment form. You will need to complete that enrollment form for you, and if you have a spouse, there's room for your spouse also, and send that to the Board of Pensions. Kelly's team will process that, and that will be included. If it's received before November 1st, it will be included in the first file. If not, don't worry, we'll be catching up on any of those late enrollment forms and ensure that you get your cards.
Hey, Sharon, can you clarify, because I know I've gotten this question around, I really don't think I want the Humana coverage. So you're saying you're auto-enrolling me. What's the process for waiving that coverage? If you could just share that.
Sure, I'd be glad to. So we suggest that you do call the Board of Pensions. We'll be able to send you a Medicare waiver form for you to waive the coverage for 2024. It will also be on pensions.org in the next week or so, but we would want to make sure people know that you will no longer have the Medicare supplement and that you should take advantage of the resources of SHIP and VIA benefits to make sure you have coverage, more than the Medicare A and B.
I'll add, Carrie, if I could, is that, again, this is an area very tightly controlled by CMS. There are a lot of rules that they impose, not just on Humana, but on all Medicare Advantage plans, whether they're group or individual, around opportunities to enroll or opportunities to waive.
It's very helpful to know the mechanics, ladies, and the reiteration of the processes. I'm going to shift gears yet again and ask about the appeals process. One of the things that our Medicare supplement plan population loves is that they know that we had been the last resort, the final appeal. What's going to happen with Humana? Can you explain the appeals process, please?
We actually haven't been the last resorts for the appeals in many years because of the Affordable Care Act, so that changed things. But we do watch claims and, we do advocate for our members. So the appeals process will be that your first appeal will go to Humana, and then if you needed to appeal again, you would send another appeal to Humana and they would send it to an external review organization who will look at it differently. You can also be in touch with Kelly's team to help walk through that, just so that we can, be in touch and help with anything. But as Pat mentioned earlier, a lot of times it's just because Humana doesn't have enough information. We find that even with appeals at the board, with Highmark and Quantum right now, that sometimes it's just not enough information to make a decision.
Decisions are often made based on protocols, standards.
Mm-hmm.
And so, if you look at a knee replacement, there might be a protocol that suggests no inpatient rehab. And that might be appropriate for 90% of all patients. And so that becomes more normative. But if a patient has a physician who believes that patient needs a different kind of rehab, it is really up to that provider to be the advocate for the patient. And that's what Humana was trying to explain to us about the involvement of providers. They often, if they just could hear the rationale and have a direct peer-to-peer conversation with a physician, a lot of those appeals would be avoided.
Another topic that's hot in the Q&A is how are we handling behavioral health issues?
So behavioral health providers are in the Humana network. So the same way that we handle them today, so they will be covered as a regular visit would. Again, the provider has to bill Humana, or the member has to be able to complete a claim form and maybe have to pay up front if it's a Medicare provider, and that will not bill Humana.
Thank you very much.
Mm-hmm.
Another topic that's hot is, what do we do about hospice situations? How will that be handled?
Hospice is covered under most Medicare plans, all Medicare plans, I should say. Absolutely. And, it would be the same way. The hospice provider needs to be in the network and willing to bill Humana. But hospice is most of the time covered at 100% for anyone during their time that they're in hospice.
That's one of those Medicare standards, frankly.
Absolutely.
And there's been an increased emphasis, frankly, by CMS on hospice care. There used to be requirements around declaring when approximately an individual patient might die, and that is no longer a requirement. A physician simply needs to, again, be in touch with the provider, and it's more palliative hospice care, and has grown extraordinarily more liberal than it was back in the day, but heavily regulated by Medicare.
It's helpful to have those clarifications about what standard Medicare has, what original Medicare has required, and what we're doing with this Medicare Advantage plan. Thank you both. Now, I see that we've got a little more than 5 minutes left in our time together. So I want to pose the next to the last question to you ladies. And that is, how do I identify myself when calling Humana customer care?
Today, we have sent a list of everyone who has received the letters regarding the Medicare supplement plan or has retired since that point. We have sent their names to Humana. So you should be able to, for example, I would use my name, Sharon Castillo. I would give them my date of birth, and they will ask for some demographic information. And what the demographic information is so that they can complete a record so that they can log the call. It's not to enroll you right there. It is so that they can make sure if you need to call again, you don't have to repeat yourself. So it's your name, your birth date, and your address.
And one of the things that I would add there is we've listened to a lot of calls from our members that have called Humana, and they have been very excellent calls. They have been very helpful, and they have really triaged our calls with a level of care that I think we can be proud of. So one of the things I just want to say again is call Humana if you need help. If you don't get what you need from Humana, call the board and we will walk with you to get your issue or your concern resolved.
And Kelly, you mentioned earlier that people would call the board for eligibility confirmation. So if for some reason Humana does not have your name, that happened kind of early on a few occasions, because all we did was give them a list basically of names. We haven't shared full files with them at this point. This was really just to populate a system so that they could not mislead someone in giving them information and then subsequently learn that the individual wasn't eligible. But if for some reason they don't have your name before January 1, when they will have every bit of information, just make sure that, as Kelly suggested, you rely on us to help you through that eligibility question.
Thank you very much, ladies. I'm going to make this our last question because it's a topic that has a broad range. How are we planning to handle prescription drug coverage? For example, will the Express Scripts file be sent along to our Humana partner? How will this happen?
Yeah, so yes, the Express Scripts will be sending a file of all the medications members are on today. If you have any mail order prescriptions, the open refills will automatically transfer to Humana, with the exception of controlled substances. And you'll receive a letter about those prescriptions. So they will have a file. So for prior authorizations, for example, if you've been on a medication before, and sometimes that's a requirement for prior authorization, they'll have a history of your prescription, so they'll know you've already tried that prescription. Now, keep in mind, we've only been with Express Scripts for 2.5 years, so they don't have a full history, but they will receive the last 2.5 years.
Fantastic. Anything else the rest of the panel would like to add? Okay,
Just
ladies.
again, my thanks for an hour of attention and my request that concerns we haven't addressed, that you find a way to get to Kelly's very skilled team and make sure we know what they are.
Wonderful. Thank you.
Can I just add to be looking for your enrollment kit? So that's in the next couple of weeks. So I really want you to be on your lookout for that. Thanks, Gary.
Thanks,
pleasure. Everybody.
I want to reiterate all those thanks for everybody's participation today. I want to thank our panelists, Frank, Pat, Kelly, Sharon. We're grateful for your honesty and your vulnerability in this process. And to our participants, our attendees today, we hope that this has been a helpful time for you. I'd like to highlight 3 things for us. Multiple times this has been asked, and I want to give you an assurance. A recording of this town hall will be available, and all eligible retirees will receive a link to register for the informational webinars with our Humana partners. As Sharon told us, those webinars will be taking place October 10th, 17th, and November 7th between 2:30 and 3:30 p.m. Eastern Time. Questions we were not able to answer today, but many of them, you've asked great questions. They will be topically organized, and we will place them with our answers onto the Humana page of our website's frequently asked questions. I also want to let you know that you can always reach out, not just to Kelly's excellent team, because they're there for you every step of the way, but also to your church consultants. My colleagues and I, the discipleship dozen of us, we're always willing to help. Thank you again for being here, and God be with us as we go our separate ways. Friends, have a great rest of your day.